Hey everyone, it's your Gyni, and today we're talking about something that can be a little scary for new parents: neonatal jaundice. It's actually super common. You might even notice it in your own little one. But don't worry, in most cases it's totally harmless and clears up on its own. In this video, I'm going to break down everything you need to know about jaundice, from what causes it to how to spot the signs, and when it's time to call your doctor. So, what exactly is jaundice? Jaundice is a common condition in newborns, but it can be concerning for new parents. Understanding what it is and how to recognize it can help you take the necessary steps to ensure your baby's health. Basically, it's a yellowing of the skin and the whites of the eyes. This yellowing is due to a substance called bilirubin. It happens when there's too much bilirubin in the baby's blood. Bilirubin is a byproduct of the normal breakdown of red blood cells. Bilirubin is a yellow pigment that's naturally produced when red blood cells break down. Normally, the liver processes bilirubin and it is excreted from the body. Now, in most cases, the baby's liver filters out the bilirubin, no problem. However, in newborns, the liver might not be fully developed to handle the bilirubin efficiently. But sometimes, especially in newborns, the liver isn't quite up to speed yet and the bilirubin can build up. This is why jaundice is more common in newborns than in older children or adults. Now, the first thing you'll probably notice is that yellow tinge to your baby's skin. This yellowing can be subtle at first, but can become more pronounced over time. It usually starts on the face, then spreads to the chest, tummy, and legs. The progression of jaundice can give you clues about its severity. You might also notice it in the whites of their eyes. This is another key indicator that your baby might have jaundice. Keep a close eye on your little one's behavior too. Behavioral changes can sometimes accompany jaundice. Are they sleepier than usual? Harder to wake up? Not feeding as well? These behavioral signs can be subtle but important indicators of jaundice. These could be subtle signs of jaundice. It's important to monitor these signs closely and consult with your pediatrician if you have any concerns. And while you're changing those diapers, take a peek at the color. The color of your baby's urine and stools can provide additional clues. Dark yellow urine can be another indicator, as well as pale, chalky stools. These signs suggest that bilirubin is not being processed properly. Remember, every baby is different, and jaundice can present itself in different ways. Some babies might show more obvious signs, while others might have more subtle symptoms. But if you notice any of these signs, it's always best to err on the side of caution and give your pediatrician a call. Early detection and treatment can make a significant difference in managing jaundice effectively. One of the simplest yet most effective ways to combat jaundice is through frequent feeding. Think of it like this. Feeding is like flushing out your baby's system, helping them get rid of that excess bilirubin through their poop and pee. For breastfeeding moms, aim for at least 8 to 12 feeds a day. That's every 2 to 3 hours, around the clock. I know, those early days are exhausting, but trust me, those frequent feeds make a world of difference. If you're formula feeding, stick to the same schedule, every 2 to 3 hours, offering about 30 to 60 milliliters per feed. Now, if your little one is super sleepy and having trouble waking up for feeds, don't be afraid to gently rouse them. You can try undressing them a bit, changing their diaper, or gently stroking their cheek to encourage them to wake up and eat. Chapter 3. Let the sun shine in. You know how sunlight is good for you? Well, it can actually help with mild jaundice too. Sunlight helps break down bilirubin in your baby's skin. But hold on, before you go laying your little one out in direct sunlight, remember, their skin is super sensitive. Instead, find a nice, bright window and position your baby so they're getting indirect sunlight for about 10 to 15 minutes, 3 to 4 times a day. Make sure their skin isn't exposed to direct sunlight to avoid any sunburn. Think of it like giving your baby a little dose of natural light therapy. And hey, it's a good excuse to soak up some vitamin D yourself while you're at it. Chapter 4. When to seek medical attention. Okay, so we've talked about the common signs of jaundice and some things you can do at home to help. Jaundice is quite common in newborns and usually isn't a cause for alarm. However, it's crucial to know when the situation might require professional medical attention. But when is it time to call the doctor? First and foremost, trust your gut. As a parent, you have a natural instinct when something isn't right with your baby. If you ever feel uneasy or notice something unusual, it's always better to err on the side of caution and consult your pediatrician. If you're ever worried or something doesn't feel right, don't hesitate to reach out to your pediatrician. They are there to help you and your baby, and no question is too small or insignificant when it comes to your child's health. Here are a few specific things to look out for that warrant a call to your doctor. If the jaundice seems to be spreading, especially if it reaches below your baby's belly button or down to their legs, that's a sign that the bilirubin levels might be getting too high. This could indicate that the jaundice is more severe and needs medical intervention. If your baby is refusing to feed or is extremely lethargic and difficult to wake up, that's a big red flag. Babies should be feeding regularly and showing signs of alertness. If they are not, it could be a sign that the jaundice is affecting their overall health. Listen to their cry. Is it high-pitched or irritable? A high-pitched or unusual cry can be a sign of discomfort or distress. Babies communicate through their cries, and a change in the pitch or nature of their cry can be an important indicator that something is wrong. That could be another sign that something's not quite right. Check their diapers again. Monitoring your baby's output is crucial. Dark urine and pale or white stools are also signs to watch out for. These can indicate that the liver is not processing bilirubin properly, which can be a serious issue. And lastly, if the jaundice persists for more than 2 weeks, it's definitely time to get it checked out. Persistent jaundice can be a sign of underlying health issues that need to be addressed by a healthcare professional. Always remember, when in doubt, it's better to seek medical advice to ensure the well-being of your baby. Chapter 5. Medical treatment options. In most cases, jaundice resolves on its own with proper feeding and monitoring. This is because feeding helps the baby pass bilirubin through their system. Breastfeeding is particularly effective as it encourages frequent bowel movements, which helps eliminate bilirubin. However, if breastfeeding isn't an option, formula feeding can also be effective. The key is to ensure that the baby is well hydrated and is feeding regularly. Parents should keep a close eye on their baby's feeding patterns and stool color, as these can be indicators of how well the jaundice is resolving. But sometimes your doctor might recommend some additional treatment, especially if the bilirubin levels are very high. High bilirubin levels can be dangerous and may require more intensive treatment. During consultations, doctors will often explain the various options available and the reasons for choosing a particular treatment. It's important for parents to ask questions and understand the rationale behind the recommended treatments. This can help alleviate any concerns and ensure that they are fully informed about their baby's health. One of the most common treatments is phototherapy, or light therapy. Phototherapy is a non-invasive treatment that uses light to break down bilirubin in the baby's skin. This treatment is highly effective and is often the first line of defense against high bilirubin levels. The blue light used in phototherapy is specifically chosen because it is the most effective wavelength for breaking down bilirubin. This treatment can be administered in a hospital setting or at home, depending on the severity of the jaundice and the resources available. It sounds fancy, but it's actually pretty simple. The equipment used for phototherapy is designed to be user-friendly and safe for newborns. Doctors and nurses will often demonstrate how the equipment works and explain the benefits of the treatment. This can help parents feel more comfortable and confident in the treatment process. Understanding how the treatment works can also help parents monitor their baby's progress and ensure that the treatment is being administered correctly. Your baby is placed under special blue lights, either in a crib or while they're being held in a special blanket. The blue lights help to break down the bilirubin in the baby's skin, making it easier for their body to process and eliminate it. The treatment is usually administered for several hours a day, and the duration can vary depending on the severity of the jaundice. Parents can often stay with their baby during the treatment, providing comfort and reassurance. These lights help break down the bilirubin in their skin, and it's completely painless. The baby may feel a little warm under the lights, but the treatment is generally very well tolerated. It's important to ensure that the baby is comfortable and that their skin is not getting too hot. Regular monitoring by medical professionals can help ensure that the treatment is effective and that the baby is safe and comfortable throughout the process. Your baby might need to wear a little eye mask to protect their eyes from the light, but other than that, they can hang out in their diaper and soak up those healing rays. The eye mask is an important part of the treatment as it protects the baby's sensitive eyes from the bright lights. The mask is designed to be comfortable and secure, ensuring that it stays in place during the treatment. Parents can help by making sure the mask is properly fitted and by keeping an eye on their baby to ensure they are comfortable. In rare cases, if the bilirubin levels are extremely high or if phototherapy isn't working, your doctor might recommend an exchange transfusion. This is a more intensive treatment that involves replacing a portion of the baby's blood with donor blood. The procedure is usually performed in a hospital setting and requires careful monitoring by medical professionals. It's typically reserved for cases where other treatments have not been effective or where the bilirubin levels are dangerously high. This is a procedure where a small amount of your baby's blood is removed and replaced with donor blood. The goal of the exchange transfusion is to quickly reduce the levels of bilirubin in the baby's blood. The procedure is performed under sterile conditions and is closely monitored to ensure the safety of the baby. While it may sound daunting, exchange transfusions are generally safe and can be life-saving in severe cases of jaundice. It's a safe and effective procedure, but it's usually only reserved for severe cases. After the procedure, the baby will be closely monitored to ensure that their bilirubin levels remain stable and that they are recovering well. Parents can take comfort in knowing that exchange transfusions are a well-established treatment with a high success rate. With proper care and monitoring, most babies recover fully and go on to thrive. Outro, you've got this, parents. So there you have it, everything you need to know about neonatal jaundice. Remember, it's incredibly common, and most cases resolve within a week or two with proper care. Keep an eye out for those signs. Don't be afraid to ask your doctor any questions, and trust your instincts. You've got this, parents. And remember, if you have any questions or concerns about your baby's health, don't hesitate to reach out to your pediatrician. They're your best resource and are there to help you navigate those early days of parenthood.